Three things you are doing every single day are making your sciatica worse. One happens in your kitchen, one happens on your scale, one happens every single night in your bed. None of them are dramatic. All three are fixable starting today. And by the end of this video, you will know exactly what each one is doing to your sciatic nerve and exactly how to fix all three starting tonight. Stay with me. This is one of the most practical videos I have made. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. Drop a comment below. Your age, your city, how many months you have had sciatica. I read every single one personally. Mistake 1, standing in the kitchen too long. Most seniors stand in their kitchen for 20 minutes or more without ever realizing what this is doing to their sciatic nerve. Cooking dinner, washing dishes, preparing meals, cleaning counters, all while standing flat-footed in roughly the same spot for extended stretches of time, sometimes without even noticing how long it has actually been. Here is exactly what is happening beneath the surface during those 20 or 30 minutes. When you stand still, your spine is bearing your full body weight through a column of vertebrae and discs that are designed to handle movement and changing pressure, not sustained static load. Walking, shifting, sitting down periodically all redistribute pressure across the discs in a way that prevents any single point from bearing excessive sustained compression. Standing still removes that redistribution. The same point in your lower spine bears continuous pressure the entire time you are standing. And the discs at that level, already compromised in someone with sciatica, compress further under that sustained load, increasing pressure on the nerve roots that form your sciatic nerve. This compression accumulates the longer you stand. At 10 minutes, the effect is modest. At 20 minutes, it is built considerably. At 30 minutes or more, which is genuinely common during meal preparation, holiday cooking, or extended kitchen tasks, the cumulative compression on the nerve roots can be significant enough to trigger or worsen a flare that lasts well beyond the time you actually spent standing. The fix is straightforward but requires actual discipline to follow consistently. Stand for no more than 10 minutes at a time. If you do not trust yourself to track this mentally, and most people do not because kitchen tasks are absorbing and time passes without notice, set a timer on your phone or a kitchen timer for 10 minutes before you begin. When it goes off, stop what you are doing if possible, sit down for 2 to 3 minutes, or at minimum shift your weight significantly. Take several steps away from your standing spot and gently stretch your lower back before resuming. This break does not need to be long. 2 to 3 minutes of sitting or even simply walking to another room and back is enough to interrupt the sustained compression cycle and allow the discs to partially redistribute the pressure that has been building. Then, you can return to your task for another 10-minute segment. For longer cooking tasks, break the entire process into 10-minute working segments with short seated breaks between each one. A task that would normally take 25 minutes of continuous standing becomes 3 10-minute segments with 2 short breaks. The total active time is similar, but your sciatic nerve experiences 3 separate periods of moderate compression with recovery time between them, rather than one extended period of accumulating compression with no recovery at all. If you cook regularly, consider keeping a stool or chair nearby in the kitchen specifically for these breaks. So sitting down is genuinely convenient rather than requiring you to walk to another room. Removing the friction from taking the break makes you significantly more likely to actually do it consistently. Mistake 2, carrying extra body weight. This is an uncomfortable topic, and I want to address it the way I would with any patient, directly without judgment because it genuinely matters too much to skip. Extra body weight, particularly weight carried around the midsection, increases the mechanical load placed on your lumbar spine with absolutely every movement you make throughout the day. Standing, walking, sitting down, getting up, bending. Every single one of these movements requires your lower spine to support and stabilize more weight than it would otherwise need to. More weight translates directly into more compressive force on the intervertebral discs and more pressure on the nerve roots that form your sciatic nerve. This happens continuously, all day, every day, completely independent of whatever else you are doing to manage your sciatica. This means that even a comprehensive sciatica protocol, good supplements, consistent stretching, proper sleep positioning, is working against a baseline of mechanical load that excess weight is continuously adding to your spine. It is somewhat like trying to bail water out of a boat while a hole continues letting more water in. The other interventions help, but the underlying mechanical burden remains elevated until the weight itself is addressed. I want to be clear that this is not about appearance or about meeting some external standard. This is specifically about the mechanical physics of load on an already irritated and compressed nerve. Research consistently shows that even modest reductions in body weight produce measurable reductions in lumbar spine pressure and correspondingly measurable improvements in sciatica symptoms, often noticeable well before reaching any particular target weight. The fix does not require a dramatic overhaul of your entire life. In fact, dramatic changes are usually the ones that fail to stick. What works consistently is small, sustainable daily choices that compound over weeks and months. Slightly smaller portions at meals. Not severe restriction, just modest reduction. A short daily walk, even 10 to 15 minutes, which also happens to support disc health and circulation independently. Reducing sugary drinks and replacing them with water. These small choices, repeated daily without exception, produce gradual and sustainable weight reduction that directly reduces the mechanical load reaching your sciatic nerve over time. You do not need to reach an ideal weight to feel a difference. Even a reduction of 5 to 10 pounds can produce a measurable decrease in the pressure on your lumbar spine and a corresponding improvement in how your sciatica feels day to day. The goal is not perfection. The goal is consistent forward progress that reduces the mechanical burden your spine has been carrying. If this feels overwhelming to approach alone, consider discussing a structured, medically supervised approach with your healthcare provider, particularly if you have other health conditions that need to be considered alongside any dietary or activity changes. Mistake 3. Sleeping in the wrong position. Every single night, for 7 or 8 uninterrupted hours, your sciatic nerve is either being protected or being actively compressed based entirely on the position your body settles into while you sleep. This happens completely outside your conscious control. You cannot monitor or correct your position while asleep, which makes getting the setup right before you fall asleep especially important. Most seniors sleep in whatever position feels most familiar or comfortable, without ever considering what that position is doing to their sciatic nerve over the course of an entire night. And several extremely common sleeping positions are working directly against nerve health for hours at a stretch. Sleeping flat on your back without any support under your knees allows your lower spine to settle into an exaggerated curve, increasing pressure on the nerve roots at the base of your spine for the entire night. Sleeping on your stomach is generally the most problematic position for sciatica. It forces your lower back into its most arched and compressed position for the longest sustained period, while also typically twisting your neck to one side for breathing, compounding the strain. Sleeping on your side without any support between your knees allows your top leg to drop forward and pull your pelvis out of alignment, twisting your lower spine for hours and placing uneven pressure on the nerve roots on one side. The fix for each of these is simple and requires no special equipment beyond pillows you likely already own. If you sleep on your side, which is generally the most sciatica-friendly base position, place a firm pillow between your knees before you settle in for the night. This single addition keeps your hips level and prevents the twisting rotation that occurs when your top leg drops forward unsupported. Make sure the pillow is firm enough to maintain its shape throughout the night rather than compressing flat. If you sleep on your back, place a pillow under your knees rather than lying completely flat. This small elevation reduces the exaggerated curve in your lower back and meaningfully reduces the pressure on your lumbar nerve roots throughout the night. A medium-height pillow, positioned just under both knees, is usually sufficient. If you currently sleep on your stomach, this is the position I would most strongly encourage you to transition away from. I understand it is often a position people have slept in their entire lives and changing feels difficult. Start by placing a pillow under your hips if you cannot yet transition to side sleeping, which reduces some of the exaggerated arch this position creates. But work gradually toward side sleeping with knee support as your primary position, as this consistently produces the best outcomes for sciatic nerve protection overnight. One correctly placed pillow, every single night. This one change protects your sciatic nerve for the 7 to 8 hours each day when you have absolutely no conscious ability to adjust or correct your position yourself. 3 habits, 3 specific fixes, 10 minutes of standing followed by a genuine break every time you are in the kitchen for longer tasks. Small, consistent, sustainable steps toward a healthier body weight rather than dramatic short-term changes. 1 correctly placed pillow every single night based on whichever position you sleep in. None of these 3 fixes require new supplements, new equipment beyond pillows you likely already have, or significant expense. All 3 are things you can begin implementing starting tonight. The kitchen timer on your next cooking task, 1 small dietary adjustment at your next meal, and the correct pillow placement before you go to sleep tonight. What makes these 3 particularly important is that they operate continuously in the background of your daily life, regardless of whatever else you are doing for your sciatica. You could be doing everything else perfectly, supplements, stretches, topical products, and still have these 3 daily and nightly habits working against you the entire time, quietly limiting how much progress everything else can produce. Fix these 3, and you remove 3 sources of ongoing mechanical pressure on your sciatic nerve that have likely been working against you for longer than you realized. Now, before you go, drop a comment right now and tell me honestly which of these 3 you are currently doing without realizing it. Is it the kitchen standing, the sleep position, or the weight question? I read every single comment personally, and there is no judgment here, just practical fixes. Share this with someone whose sciatica protocol seems to be doing everything right, but still is not producing the full results it should. Subscribe and turn on notifications, because every week this channel brings you something equally practical and equally direct. 3 habits, 3 fixes, starting tonight. This video is for educational purposes only and is not medical advice. Individual results vary. Always consult your healthcare provider before starting any weight loss program or making significant changes to your daily activity or sleep routine, especially if you have other existing health conditions. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.